A medical assistant is preparing to administer a 1 ml intramuscular or IM injection of a thick oil-based medication into a 70 kilogram or 154 pound adult patient. And the question also states that the patient has a history of deep muscle pain from previous injections. Which of the following is the best approach for administering this injection? And when we look at our choices, we see that they all have different inch size needles. So the question is asking us to determine which size. They also all have different gauges. And a reminder for the gauge, the smaller the number, the bigger the size needle. So if you look over here, 23 is the smallest needle and 18 would be the largest in this question. And then the last part of each answer choice, it states which muscle you should give the injection in. And it also is stating which angle to inject at. So now you might see all this information and you might be thinking, I'm not sure where to start because they all have very similar information. I just need to determine which one is the best. So let's see if there are any that we could eliminate right away. But that's always a great strategy whenever you see a multiple choice question where you feel a little overwhelmed by the choices and you think, how could I break this down a little bit? Well, the injection is saying IM. And if you know about intramuscular injections, let's say this is the muscle, they always will be given at a 90-degree angle. So this is your injection at your 90-degree angle, 90 degrees. If you give it at a different angle, then you're not going into the muscle and you're going into a different area. So let's say at 90 degrees here, let's say this is your muscle as it gets to the fat, that's 90 degrees. If you were to take it and go at, let's say, a 45-degree angle, so go like that, you're not going into the muscle, and that would actually probably be going into the fat and be a subcutaneous injection. Therefore, in these choices where we see 45 degrees, that's not an IM injection anymore, and hence we can eliminate those options. Okay, good. So now this question is not as overwhelming because we're left with just two choices to decide between. Either the 1.5 inch 21 gauge needle into the ventrogluteal site, or a longer 2-inch needle that is 18 gauge, so it's a bigger needle, and inject into the dorsogluteal site. Now, for two reasons, we could determine why a certain answer is better than the other. So if we take a look at option B over here, you see your 1.5 inch needle, your 21 gauge needle. This is a smaller needle size than your 2 inch and your 18 gauge. So that's looking good because we're talking about a patient here. Good. We are talking about a patient here who has a history of deep muscle pain. So we want to create a better experience for this patient, and by using a smaller needle, that is appropriate. Also, going into the gluteal muscles typically work better when you have a large oil-based medication that we're talking about here. It usually is going to be safer for a thicker medication. Also, when you look at option D saying the dorsogluteal site, the dorso you have to be careful for accidentally hitting the sciatic nerve, which you don't have that risk with the ventrogluteal site. So for that reason, option B is going to be our answer here.